welcome to the NCCDP YouTube channel. I'm your host, Alexandria, and joining us today is Kari Johnson. Welcome to the channel.
Hello, thank you.
So before we get into what we're going to talk about today, can you just share a little bit about who you are and what you do and how you relate to dementia care in your life?
Oh, that's a question. Who am I? I am someone that grew up in the hospital environment. That's where I went after school because that's where my mother worked and started a trauma program. I was a social worker in Southeast London and moved back to the U.S. to become an occupational therapist. I've worked with those with dementia since I was 16 and, have worked with them primarily in skilled nursing facilities, the home environment, and then also those that have been in the hospital. As of now, I have also transitioned to being a board certified patient advocate. And one of the other bigger roles in my life was caring for my father, Bert, for 16 years after a hemorrhagic stroke, a history of alcoholism, and then he developed dementia. He passed away in October of 2023. So I have been working with those with dementia and living with someone with dementia for a long time.
So I definitely want to talk about your story with Bert, but before we get into that section or that part, I would like to hear more about specifically with your work in dementia care and with your patients and everything. What do you enjoy most about working with people with dementia?
I think to me it is kind of unlocking a mystery. A lot of times they can't tell you when they're in pain, when they're uncomfortable, when they're happy, when they're sad. You really have to be good at assessing their behavior on the outside, and not only assessing what you see on the outside, but what may be going on in the inside in terms of pain, etc. And so for me, I would say that what I like is kind of unlocking that mystery and helping that person find a place of comfort and not feeling uncomfortable and out of sorts. Because for someone with dementia, it is very hard to understand what is going on around them.
Definitely. And on the other end, what challenges you the most, or what is the hardest aspect?
The same thing, trying to figure out what's going on and what assessments to utilize. Has this been successful? If it's not successful, what do I do? Who do I call? Who do I refer to? What I found is the number one key to it is patience and persistence, because they are telling us things even if they're not using words. So it's complex, but I like it because it's challenging. It's a mystery to figure out. And then you have those family members that are in pain because of what they're watching. And so being able to unlock that and providing comfort, I think, is super important, not just for the person, but for their family as well.
And so also speaking on family, since that it affected your family, look at that segue. How was it also having someone in your family and someone you're taking care of at home with dementia while also working with people with dementia?
Oh, there were days that I really didn't know what to do because obviously with my father, he was still drinking as he developed the dementia and had the stroke. So the part of the brain that tells you not to call your daughter screaming or saying that, you're going to do such and so during her work day, that part wasn't there. The wild man, needed what he needed when he did. So the challenge was, stepping off at the work floor from a client, trying to assess quickly what was going on with him and trying to solve it as much as I could. One day he called and he said, "I'm just going to end it all." And I thought, what are we talking about? So I said to my boss, I said, "Give me just a second, I got to make a call." And so I called back. I said, "You don't normally talk like that, Dad. You're going to end it all." He said, "Well, I saw that the Twins game is on, so I guess I'll wait." And I thought, he just needed somebody to talk to. That's what it was, and that reassurance that I can call Kari or my sister Christy if I'm feeling down. And so my solution was, "Daddy, I got to work right now so that I can pay the bills and send you groceries, and I'll call you later and we can talk about how you're feeling."
Did you ever have moments where it just became too much, where your entire life was just dementia and its effects and everything that has to do with that? Did you ever feel like you couldn't get a break because it's everywhere?
Yes. I should say that while I was working with people with dementia, I typically as an OT worked PRN, meaning that I would work as needed, or, sign up for certain shifts. And the reason I had to do that was so that I could travel home if I needed to, if my dad was in the hospital. So I kind of lost where your question went.
About if, because you were working with dementia care and treatment and all of that, and then also your home life had a lot to do with that as well, if that ever became too much or isolating, or if you were just over it because it was surrounding every aspect of your life.
Obviously, because I just got overwhelmed answering the question. So it's complex, and to explain it is complex, and then my brain goes to all of these different things that happened, and then my brain just is like, okay, we're going to shut that down. And I guess maybe that's what I did. Focus on what's in front of me, and solve one problem at a time. And at the end of the day, he had caregivers. I could text them. I should add that in the skilled nursing environment and with dementia care, I was full-time for quite some time, but then I started to fill in other areas. And so I was doing more hospital intensive, people without dementia. You would still see that some, but people with strokes, traumatic brain injuries, other injuries. So I kind of did that so that I would have a little bit better balance, so that it wasn't like dementia work, dementia home. It was always there, but I guess the way that I dealt with it is exactly what I just did when you asked the question. Kind of turn one part off and focus on the task that's in front of me.
It seems like, clearly it was a lot and a lot to just focus on. What do you think, what are the biggest lessons you learned during that season of your life?
One of the main things is to utilize the techniques with your own parent that you're teaching others to use, because I think you don't always recognize it with your own family member. And so I learned, for instance, I thought I was doing a really good thing with ordering him a bunch of groceries so that he had plenty of things to eat. And he had a total meltdown about the eggs. He called 3 days in a row about the eggs. I don't know what to do with the eggs. I haven't cooked eggs in ages. I don't know what to do about the eggs. The reason that I got them was to have the caregivers boil them so that he would have some protein. But in his mind, he needed to make some sort of souffle or quiche, or I don't know what it was that he thought he needed to do. So finally I was like, just throw the eggs away, and eventually they boiled them, and he called and he said, "Hey, Kara, these are fantastic. These are fantastic eggs." And that was how Bert, how he scored things. They were either fantastic, kick-ass, or terrible. So
no in between.
No. Most things were fantastic.
I know we're probably going to be talking about Bert in further videos, just in regards to the specific topics that we'll be touching on in later videos. But to kind of just, not generalize, but generalize, with all of your experience, both actually working in this field and experiencing it at home, how do you think dementia care can be improved? I
think knowing the person is essential. Staffing is a major thing in this country that we need to address, because it's very essential to know the person well so that you can read their nonverbal communication. Because at a certain point, they aren't able to tell you what they're feeling. You have to know them well enough to be able to identify, okay, they're looking as if they're in pain, etc. So when I teach, especially, I always focus on know the person, and not just what did they bake, or did they like baking, but what did they bake? Did they have pain? What sort of, how did your family address pain? It really gets into assessment. And if we can't have consistent staffing, how do we know that person well? Because there's issues that come up, and if you don't know that person well, it's difficult to address those. The other major challenge is, where is everyone going to live? Because most people don't know memory care units are like $9,000 and $10,000 a month, and mostly are private pay. Medicaid typically doesn't cover many, so that's the other thing that we need to focus on, majorly. Where is everyone going to live?
I didn't realize it was that much money. That's insane. Wow. Sorry, I'm processing that.
Yeah, it was, and the hard part, my mother was very successful. She'll have to pay for where she lives until that money runs out. That's how it goes. My
Mhm.
dad didn't, so we had to put him on Medicaid. Well, the Medicaid rooms aren't always necessarily as nice as some of the others,
Yeah.
which was shared with me as I was dropping him off. You know, how do you feel good about that? You already feel bad you're dropping a parent off. And they say, well, it is a Medicaid room. I looked the other day, and to pay for care at home 24 hours was like, I don't know, just a massive, massive amount of money that most people wouldn't be able to afford. So that is what we need to address in this country. Where will everyone live?
I know we hadn't really planned to like fully on how to dive into this as a separate little specific topic within this. I'm curious, you mentioned that Bert was also a drinker. How did that impact his journey with dementia, his care, day-to-day life? How do you balance that? Or were there any like issues with that?
You know, it was interesting when he was tested for dementia. Nobody ever actually asked me what his drinking history was. He started at 16 with blackout, and we don't really talk about it that much. And it's one of those, you know, brain-related dementia or alcohol-related dementia is different. People can fluctuate with their cognition. If they haven't drank for a while, things can improve. Things can almost heal. And so one of the things in this country is people don't know, do we assess them when they're drinking or do we assess them when they're sober? For him, the challenge was he had also had the stroke, so there was some vascular dementia. So the challenge for us was to try and figure out what is causing what. The interesting part was, out of about 25 hospital admissions, not once was there alcohol in his system. It was the after effects.
Oh.
But they tested for it every time. And when you have ETOH on your chart, which indicates alcohol abuse, people are treated differently. I've seen it. Because you're doing it to yourself. You know, you're causing this yourself. So for me, that was the challenge, because he loved everybody and wanted to visit with everybody. And some healthcare professionals would talk to him in a way that was like, well, Bert, if you keep drinking, you're just going to get worse, as if he didn't know that. I saw on his chart somewhere else where it said he just babbles all day. No, he's trying to make a connection. Now, my mother, who's a retired nurse, she'll be treated completely differently. So it was challenging. You know, you don't want your parent to be seen as less than other people. But when you have a history of alcohol abuse, that often can happen.
Do you think, have you seen in your own experience of just working in this industry, have you seen a lot of other patients that are kind of facing those same issues, whether it's with because of alcohol or maybe, I don't know, something else as well, causing them to be treated differently or not cared for?
Those with diabetes, if they're not, you know, controlling it or eating things that they shouldn't be, sometimes they're spoken to like, you're doing this to yourself, or almost that tone of stupidity. The interesting that I would always see, those that had the same background as my dad always seemed the loneliest, and they are. People, I mean, would you choose to be an alcoholic? You know, would someone choose that? Because there's a lot of guilt. And so I would go in to assess someone, and they would be down and out, no families visiting. Other professionals may be like, oh, you know, it's just that guy, he's just going to go home and drink again. And I specifically remember one time sitting down next to a gentleman and putting my hand on his back, and I said, do you have anyone? And he said, no, none of my family will talk to me. And I said, this isn't your fault, and you deserve love just like anybody else. And the person that was working with me was like, why'd you do that? And I said, because I would want someone to say the same thing to my father. It's a person with a disease, with a condition. They're not better or worse than anybody else. I mean, unless they do bad things to other people. But that counts for drinkers and not. So that's how it affected me in the workplace, and that's how my father's alcoholism affected me. I had a soft spot for those people because they had person after person making them feel guilty about themselves. That doesn't promote well-being.
Well, thank you for sharing all of this stuff. I know I'm very appreciative that you're an open book, but I know it's also can be hard to talk about because it's just It's a lot. It can be overwhelming.
I think the hardest part is not talking too much, because there is so much, and then remembering what you're asking me, because I start to think of all of the things, because my father had his stroke when I was 27, and I started as in nursing homes as a CNA, in my teens, in 16, 17, in a independent and assisted living. And so when you ask these questions, it's, it's like I'm thinking through all of those years and all of it. And I often forget, it can all come flooding back at once. So
Yeah.
I'll try and stay on track, I promise.
Well, I know that you are filled with a lot of good wisdom and good stories. So whatever you want to share, whatever you happen to say, we are happy to listen.
Well, we'll both find out when it comes out of my mouth, won't we?
So let's wrap up this video. We do have a few more videos with Kari about specific topics related to dementia care. So thank you for joining us. And if you maybe have any specific topics within dementia care that you're interested in hearing more about and us covering, let us know. We want to hear from you. If you're interested in learning more, or maybe even becoming certified as a dementia practitioner, the link to our website will be in the description along with the rest of our socials. Thanks for watching, and we'll see you next time.